Check 1, 2.
Well, hello there, boyfriend. How are you this fine day?
I'm really good.
Is it working?
Yes.
Excellent. Let's not touch shit.
I'm afraid to ask, but I have a great question.
I don't even know what I was going to say. I'm so disturbed right now.
I think you were about to say this, but we had somebody ask, you know when you're ever in Walgreens and you go
I was there today.
You were there today. And they go, you could buy NyQuil or you could buy like wall quill, right? Mm-hmm. It's like the Walgreens version. Question came in. I had the guy's name. I think it was Trevor. I don't remember. On Instagram. And he said, name brand or store brand, is there a difference? And is there a difference prescription, name brand, like, because it can be so much cheaper, right?
Yeah, that's a great question. So,
Thank you, Trevor.
Thank you, Trevor. I like that question. I get asked that question daily, honestly, in my practice. In general, the generic is almost equivalent, if not superior sometimes, to a name brand for various reasons. How they compound it, the fillers. The easiest thing to say is
you said the generic is superior?
Sometimes.
Wow.
But usually they're equivalent. All right? So that's what you think of. It's the same thing. The problem is
we should save the money and just get a generic?
So a few times people will react more favorably to name brands. The very prime example of that is Synthroid, levothyroxine, the generic thyroid medication for people who have an underproducing thyroid, for example. Some people only respond to the name brand, and we don't know why. It just happens to be more probably metabolically favorable. It works better in their systems.
Can I ask a question that might be a clarification? Are you saying these are not the same? The active ingredient is the same.
The active ingredient.
So these fillers could be affecting how
they're produced and manufactured. Sometimes I'll have people have an allergic reaction to the compound itself, not the active ingredient.
Gotcha.
The casing on the medication, for example, or what they bind it with. So yes, in general, generic is just as good. It's way less expensive. I recommend it. I most of the time prescribe generics. What you also have to know is that, did you know doctors can prescribe things like acetaminophen and ibuprofen? So
I only know that from you.
So I can prescribe that.
Yeah.
And with insurance plans, this is the one time I like insurance, it usually makes it cheaper to buy prescription Tylenol than over-the-counter Tylenol.
Yeah.
But the controversy is, where do we get our funding for studies to develop new drugs? So I do support name brand medications being expensive when they're first coming out, because the drug company has to be motivated to do trials and studies to prove its efficacy and also look at the side effects. And if we're not benefiting these companies by giving them monetary compensation, they won't run the studies in the first place. We won't have new medication become available.
So you're saying
things like Alzheimer's, things where we need new forefront medications to arise. We're not doing the studies if we're not compensating. So I do believe in the beginning to have that patent where you can't have a generic available is necessary for us to have the study. Right? But then we need to have generics available so that people can afford it.
Yeah, but
when
that's
you have
the way it is, right?
$5,000 a month medication, that's not practical.
But that is the way it is, though, right? Like if Propecia comes out, they do get a few years where it's just Propecia.
Typically, yes.
And then, but you're saying in general, if you do go I was trying to make another argument. I'm not smart enough to do this, but I was going to say, as a doctor, if I don't know what the casing is or the fillers, I wonder if I would rather everyone takes whatever it is, Propecia, so I could go, hey, this is what I'm seeing in my patients. Because for me now it's super consistent because it's the active ingredient combined with all the same compounds.
The most frustrating one out of all of that, guess the medication that has more substitutes, where I will put in the name of a generic.
Viagra.
No, I will put in the name of a generic and 500 options will pop up, and the pharmacy will give the patient whatever they've got, even though the compounds and fillers can be different. And then I'll have the patient come back a month later and say, last month my pills were yellow, this month they're blue. Yeah. And they're different. And the pharmacy doesn't even tell them. Birth control pills.
Oh, birth control pills.
And I've had a lot of people have bad reactions. Worsened mood, weight gain, changes in their acne control. And it's all because of the fillers and the compounds. Their menses are completely out of whack, changing from one to another.
Follow up from Trevor?
Yeah.
I was tempted to buy a prescription antibiotic in Mexico when I was there last week because no prescription was required. Is there a difference? Is this safe?
Don't do it.
Don't do it.
We've talked about this.
We have?
Yeah. I believe you told me a story once about your ex buying some stuff in Mexico.
Oh, maybe we had a discussion in real life? Not on the podcast?
I thought it was on here, but I can't remember. But I will say that don't ever buy your drugs out of the country because they're not regulated that we know of.
Yeah.
So you don't know what you're getting. And also they could be cut with something, meaning you're getting a less efficacious medication because the dose is cut in half, but they're charging you as if it's the full thing.
Gotcha. Don't get Mexican drugs.
I'm not trying to
Well, you shouldn't.
disparage the country.
Of course not.
I just find it to be very
Risky?
well, this is your life. You're ingesting a substance and you're trusting that it's the substance that it says on the bottle, which it very well might not be. So when it comes to your health, I would say go for something that's regulated by the FDA. I happen to trust them. I see what they do with the medications I prescribe, and that makes me feel a lot more comfortable than somewhere where I can't read the research.
I feel the opposite way about cocaine. I feel like in Mexico, this is going to be the purest, and if you buy that over here, it's going to be cut with some stuff.
I would not argue with you at all on that.
Okay. Those are great
When are we
answers.
going to Mexico?
Don't you think this guy knows? Of course he knows he shouldn't buy drugs in Mexico. It's too good to be true.
No, I don't think so. I have a lot of patients who actually send their prescriptions to Canada, but it will go directly to a pharmacy.
Yeah, that's a little different, right?
I don't know why, though. I mean,
Well, because I was going to say because there's
the
a prescription.
regulation.
But
Well,
also there's a prescription.
prescription.
In Mexico, you need no prescription for a bunch of shit.
correct.
Xanax. Some
Really?
places in Mexico. Yeah.
That's surprising to me.
You don't need it in Belize. I only know these things because I was a...
Alprazolam is a highly addictive medication, and withdrawals can actually kill someone. So that's quite alarming to me that they don't regulate it.
not to brag, I used to work on cruise ships a lot. And there were these places where we would go if you get off at this stop. And it wasn't every port in Mexico, but it wasn't like Tijuana, but it was Ensenada. And so you could get off and they would go, you go to this place, you can buy Alprazolam. What is it?
Alprazolam, generic for Xanax.
Generic for Xanax right off the shelf. All you could buy, maybe Propecia, you could definitely buy like that Z-Pack. You could buy Z-Packs.
I do
No
struggle
prescription?
with antibiotics being available like that because patients like to take them so much, and then you develop drug resistance, and then when they do get a bad bacterial infection, that antibiotic no longer works. So there's something to be said about getting mad at your doctor saying, it's a virus, I'm sorry, I can't give you an antibiotic for it. Well, duh, we're trying to protect you. It's starting to really bother me that people have access to stuff like that.
Well,
Not because I want to make a quick buck,
but they would
because
have access only in Mexico, you're saying, right? You mean like that they don't, like you don't need a prescription, you mean?
Yeah, but it's dangerous. There's a reason that we don't just give it to people.
Yeah. Yeah. There's another follow-up that I was just thinking of. This is not a question for someone else. But you know how you hear that you're supposed to take even if you feel better, you're supposed to take your whole run of prescription, what is it called? What's a Z-Pack?
It's an antibiotic.
Are you
It's
really
azithromycin.
supposed to? You know how they say some people feel better and they save it for next time? Is it really true that I have to take the whole thing?
You do, because you're clearing out the bacteria, but your symptoms improve substantially after a few days. But usually the bacteria is not completely obliterated. So then you stop the antibiotics and the bacteria just continues to grow and the infection remains.
So you got to take them.
You
I
need
always
to use it
always heard that, but I didn't know if it was true or not. Remember when we were about to... So just to reiterate, you took... what did you drink?
Magnesium citrate, an entire bottle.
Yeah.
There's nothing happening yet.
Yeah. It's a G number 2. You know, like G2? Gatorade? It's a shit drink, and clock's ticking. When did you take it? I think it was an hour ago, and it said 30 minutes to 6 hours.
Yeah, like 40 minutes ago, maybe.
Wow, I'm on pins and needles.
When I finished it was about 40 minutes ago.
So-
You're on pins and needles.
Yeah, we'll keep everybody
How do you
posted
think I
about that.
feel?
You're probably ready to be on porcelain.
Not yet, unfortunately.
So, at the end of the podcast last time, we got a question coming in from someone you were talking to. I won't say who they are, but they was on FaceTime, and I quickly grabbed my phone. I said, well, just ask it, and I'll record it, and then we could play it. We could try to answer it, and
Yep.
we'll see how we feel about this topic. I'm going to replay it, and we'll...
I think it's a lot of pressure when you go to your doctor to just talk about like your concerns, and they try to throw it back in your face, and they say like, do you drink? Yes. How many drinks do you have a week? I don't know. Do you drink every day? How many drinks do you drink every day? It feels very judgmental, and it feels like, is there a magic number? If I say like 16, I'm okay? But if I say 27, you're like, oh, okay.
I told my doctor I drink like 5 days a week one time, and he didn't say anything about it. He just like wrote it down and looked the other way. And
Could I say one thing?
What?
Well, first of all, both these people sound drunk. Number two, right before that, the dude had said, like, what is the magic number that you can have per day? Hearing that again, I think the doctor cared about her. Like, I don't think the doctor's being judgmental. I think the doctor's saying, like, I care about your health. How many drinks are you having a day?
I think it's displacement where a patient knows that they're drinking in excess and they are worried that they will be judged, and then they say it looking for a glance of disapproval. Regardless of what the doctor did, I feel like oftentimes patients would say, oh, they judged me because they expect to be judged. Sometimes I get that even when I'm really cool about it. I'm like, okay.
That is so correct. I feel like you're so correct. Do you ever hear this study?
Of course I am. I do this every day.
This study but I mean that is your opinion is that you think that they're feeling that. Like, I mean, I think that's a really cool but awareness that you're saying,
Yeah.
like that's not I don't know what I'm trying to say. Well, I know you do this every day as a doctor. I just mean like what you were saying was an observation.
Well,
of
my
what they might be
clairvoyance
thinking.
comes from a good communication style with patients. I'm not going to credit myself. I like to ask for feedback and say, what did you think? Do you feel comfortable? And they tell me. And then I do what they enjoyed regularly to other patients. So that's why I feel confident about this answer.
Did you ever hear the study? There was a study where people, I don't think I mentioned it on this podcast before. I probably told it to you because I think it's so fascinating, where they told people they were going to go for a job interview, but before they went in, they were going to give them like scars, and they were going to see like will having some sort of facial scar like affect whether or not you get this job. And so they put all the scars on and stuff, and then they had the people going for the interview, and they came out and they said, like, wow, it totally affected it. Like, this lady like wouldn't stop looking at it. They didn't listen to my answers. It's almost like they're trying to like figure out what happened to me. And what the people didn't realize was right when they went back in, they go, let me touch it up, and they removed all the scars. And so there were no scars. And so those people just thinking they had the scars felt that from the interviewer, something that was not there, which seems like I think you're right about that. Feeling a judgment that maybe you're...
Well, and then when he said on there, I told my doctor to drink 5 nights a week, and he just looked away. I think also you do have to be cautious when we do have a tone of concern with a patient. It is perceived as judgmental overtone to the point of they don't want to listen anymore. They feel very frustrated. So oftentimes I do hear drinking, and I will write it down and make a note of it, but we're dealing with chest pain or something else, and I'll address it, but I'm like, ooh, we need to talk about this later. If I come at you and I'm like, you're drinking way too much, oh my God, this person's going to be like, I'm not coming back to you. And I'm like, but I need to address your possible myocardial infarction or something, which goes hand in hand with alcohol. But my point is, you have to have a certain level of finesse when you talk to someone about it. I do that a lot with alcohol. So if I have a patient come in and I ask them how much they drink and they say whatever number, if I think it's too much, I cannot be like,
And also they know.
They do.
Like if the doctor was like, you're eating too much like asparagus and it's fucking up your heart, you'd be like, holy shit, thank you for telling me. There's no one that doesn't know that they shouldn't be drinking 5 nights a week. Why is it even coming up?
I think they want to hear that it's okay.
Right.
They want to hear from a professional that it won't be life-threatening. The hard thing is the amount of alcohol that's safe. I mean, there's crazy studies out there now that say none at all or just barely any. Doctors are trained to say, 2 servings in 24 hours for a woman, 3 servings in 24 hours for a man. But just recently it was 1 and 2 or even 1, or now we're saying none. The clear-cut answer is simple. If you're going to counsel a patient, you can't come in with being an asshole. They won't listen. But I will tell you this. If I have somebody who's drinking to excess, and I mean like getting blackout drunk every single night, I'm not going to look at them and be like, F you. I have to come from a point of caring and be like, whoa, like I've known you for 10 years as my patient. Can we cut back slowly? Instead of 10 beers a night, can you make it 8 beers a night this week? We'll go to 6 the following week. We'll go to 4, but I don't want to wait a month to see you. I want to see you in 2 weeks and check in. How about that? How's your dad doing, by the way? Okay, does that sound reasonable to you? It's almost like you have to handhold. And I don't mean to patronize these people, but did you know that alcohol withdrawal can sometimes be way more life-threatening than alcohol intoxication? So I can't just be like, you need to stop drinking.
Well, and
because if somebody takes me seriously, they're going to go to the hospital for withdrawal, and it's my fault.
Yeah, and I don't think your doctor telling you to stop drinking if you drink a lot. I don't even know if that would be the case. This person already drink. I would even think that person who drinks 10 drinks a night, I don't even know how they're going to drink 8 drinks tomorrow. They probably don't want to.
One patient with alcohol dependence disorder. I point blank looked at her and I said, I do believe you're going to die. She had ascites, which basically means your liver is failing you and your belly gets bloated full of fluid because it's just not processing the toxins like it should. You turn jaundiced, really yellow, right? You can have something called a caput medusa where the veins dilate and your stomach gets like all these weird spidery veins coming up.
Yeah.
She had all of that. And I was just like, I can't lie to this lady. Like, she is on death's door. And I said, you're going to die. We need to do something about it. And she came back 6 months later, didn't even recognize her. She was sober. And she said, you changed my life because you scared me. And every other doctor had been like judging me. You need to stop drinking. I mess up all the time too, and I don't address alcohol with everybody. I think this person is asking for, can I drink? Of course you can drink. Can you do everything in moderation healthily? We don't know, but most things, yes. Maybe stay away from cyanide, but other than that, most things in moderation are okay.
Yeah, and it is really interesting. Like, nobody wants to hear, like, I listen to the Huberman Lab a lot, and Huberman is famous for saying, I'm a professor. So I'm not like giving you my opinion. I profess. I read every single article that is available. I put them against each other and go, was this a good article? Was that a bad article? And I tell you like what it says. And I'm not telling you to drink or not drink or smoke or not smoke. I'm telling you of all the most recent research, like this is what it says.
Right.
And so he just had one and a bunch of people have like sort of echoed his podcast, like the results of his podcast. Cause he's so like, it's not my opinion. I'm just going to tell you. And then I'm not telling you to stop smoking. I will say smoking may cause cancer. I'm not saying stop smoking. I'm telling you what the research leads me to believe. And he said that it's so crazy too. Like, well, he said 0 is of course the best, and more than 2 drinks a week starts to be problematic health wise. Like 2 a week, that's very different than I can have 2 glasses of wine with dinner every night, which is what I was told my whole life.
Well, we used to say that red wine was very beneficial for cardiac health and wellness, right? Your hepatocytes, though, your liver cells are extremely regenerative. So if you go on like a week fast, alcohol abstinence for a month or so. I mean, I'm just throwing out that number, but we do have pretty good research after a week of like fasting, nothing but water. Your body goes into like the starvation survival mode and it regenerates and cleanses, and your liver cells happen to get rid of all the bad ones with apoptosis. They kill them off, good ones grow, and you've kind of reversed a lot of the damage that you've done. So the good news is you're not like completely screwed the rest of your life if you have used alcohol for a while. Whereas when I will see somebody who's used tobacco products for a long time, that's very difficult to reverse. So there's just, I think the end result needs to be this. You're not judged, but we care about you. Take care of yourself. I drink. I'm a physician. I still have alcohol occasionally. I know that it's not healthy. I enjoy it when it relaxes me, but there's a risk-benefit ratio to everything we do in life, right? If all we did was eat bags of granulated sugar and nothing else, we would probably develop diabetes very fast in life and be sick. But do we stay away from every donut our entire life? No.
Yeah, I think it's interesting that you said
about balancing it.
Because my problem with the whole thing is, I think that's really interesting what you said, that like if you quit drinking, you could everything could be better, and like if you did that. But I think the problem is that the comments under the Huberman Lab podcast were like, you're full of shit and you can take a couple glasses of wine a day. It's people that...
It's because you're not condoning or condemning. You have to be in the middle, because if you're extreme, people will get frustrated.
Which I feel like he's condemning. I think he's saying over 2 is bad. I feel like he's going...
We shouldn't. Because if you do... have an extreme view, left or right, people will get frustrated because it conflicts with what they want to hear.
But is that an extreme view, or is he just telling you what the numbers say?
people have been accustomed in society with alcohol availability to see it as a socialization, not as a bad habit. So when someone comes out and says you probably shouldn't drink, they consider it a personal attack if they drink alcohol.
So that's why I'm concerned about, you're right, it will regenerate, but I feel like a lot of people don't believe it.
People don't give their liver time to regenerate.
Yeah, or they wouldn't stop or no. There was just a huge study that was like about moderate drinking and how like a glass of wine a day or two like is like not bad or whatever, and it could be good for cardiovascular health. It was the New York Times, and they pulled the study because they found out that the two main scientists gave in like $60 million from alcohol companies, and they had to like pull the research.
Bad.
Coming up on the next episode of Afraid to Ask, but it's a misdemeanor charge. So I'm not speaking of having a prostitute in a state where it's legal. I'm saying I'm going to go to one of these establishments and they're going to be tested on a weekly basis.
I don't think they'd be weekly. Unless it was like gonorrhea and chlamydia in a urine cup.
But I don't know how you know if somebody, that's impossible.
Yeah.
Because someone just slept with somebody. Well.
And maybe you go in the room. It's just the two of you, right? There's no cameras. There's no bouncer guy. And the guy is like, I'm not wearing a condom. I will pay you $400 more to not wear a condom. I am sure that happens.
There are cameras, but it's extra.
No. This whole thing is gross. And then what happens if a girl gets pregnant? Because condoms break, by the way. And then are they required to have an IUD? Because those aren't 100% either. The whole thing is creepy.
Thank you for tuning in to Ruining the Fun with Dr. Erika.
I'm not ruining the fun.
Guess how much it costs if you get in trouble?
I want to know how much it costs to hire a prostitute.
It's usually, let me look it up.